Vaginal cancer. Vaginal cancer is a rare malignancy of the vaginal epithelium accounting for all the gynecologic cancer. Most cases are the secondary from the cervix, endometrium, ovary, or the colon. Types of the vaginal cancer: squamous cell carcinoma arises from the vaginal intraepithelial neoplasia associated with the HPV infection common in the post-menopausal women. Adenocarcinoma associated with the diethyl epidural exposure in the utero. Clear cell adenocarcinoma affects the young women. Adenocarcinoma associated with the diethyl epidural exposure in the utero. Clear cell adenocarcinoma affects the young women aged 15 to 30. Melanoma arises from the melanocytes and the vaginal epithelium, common in the posterior vaginal wall. Sarcoma, rhabdomyosarcoma, embryo type. Sarcoma botides seen in the infants and children present as a grape-like vaginal mass. Risk factors: HPV infection, smoking, multiple sexual partners, history of the cervical or the vulvar cancer, diethyl epidural exposure in the utero, chronic vaginal irritations, and the immunosuppression. Clinical features like the abnormal vaginal bleeding, malodorous vaginal discharge, pelvic weight, vaginal mass or the ulcer, urinary or the rectal symptoms. Pelvic examination. Inspect for the lesions, ulcers or the masses, palpation of the inguinal and the pelvic lymph nodes, biopsy gold standard. Once biopsy for the visible lesions, colonoscopy of the guided biopsy for the suspicious area. Imaging for the staging, pelvic MRI, local tumor extent. CT abdomen and the pelvis, lymph node metastatic spread. With PET-CT detects a distant metastasis. Staging, figure system. Stage 1, confined to the vagina. Stage 2, invasive paravaginal tissues but not the pelvic wall. Stage 3, extends to the pelvic wall or the regional lymph node. Stage 4, bladder and the rectum involvement or the distant metastasis. Treatment: early stage, stage 1 to 9. Radiation therapy, mainstay of treatment. Surgery for the small lesions. Advanced stage like radiation plus chemotherapy is cisplatin placed. Pelvic examination. Specific treatment: clear cell adenocarcinoma is related, sarcoma botryoids, and the prognosis is like a 5-year survival rate. Vaginal cancer is rare, most commonly squamous cell carcinoma, HPV related. Clear cell adenocarcinoma is linked into the utero, disc exposure. Sarcoma botryoids presents in infants or a grape-like vaginal mass. Most common symptom is abnormal vaginal bleeding. Diagnosis requires a biopsy, MRI, CT used for staging. Radiation therapy is the main treatment for the most cases. Chemotherapy, cisplatin based, is added for the advanced disease. Pelvic examination considered for the extensive local invasion.